Eye on Health on WSBT 22 is sponsored by Beacon Health System.
In this month's Eye on Health, we are taking a closer look at hip pain and why the solution to fix it may not always result in a total hip replacement.
WSBT 22's Erin Leedy is live in studio with more on how certain procedures done locally within Beacon Health System are saving people time from traveling to other cities.
John and Juliana, it's all about preserving what a patient already has, thanks to a type of care that's unique to our area. Doctors have been working with one teen with a passion for dance get back on her feet.
2 years ago, Ava Dillon's high school dance career took a turn she didn't expect.
It wasn't super severe, but as time went on, it was like I started limping. I couldn't walk very well. I had to sit down. I couldn't walk far.
The now senior at Marian High School started having hip problems that gradually got worse, and despite seeing several physicians,
nobody could really figure out what was wrong with me.
Ava would eventually meet with Dr. LeeAnne Torres and Dr. McCoy at Beacon Bone and Joint Specialists. In Ava's case, it was more about preserving what was already there by correcting bone deformity and working on the labrum, a ring of cartilage that surrounds the hip socket.
Young, particularly active patients, those without arthritis, we want to try to preserve that hip for as long as possible so that something like a hip replacement is not in the discussion for decades to come.
Dr. McCoy says sometimes the hip socket can develop abnormally. He performed an osteotomy on Ava, essentially realigning the bone. He advises people that if pain is persistent, to get it checked out.
A lot of patients that I meet often have an injury for a prolonged period of time and either do multiple rounds of physical therapy first and still having that problem. So I think if there's a persistent problem despite therapy and other measures, definitely, see our team to help address that.
Once a patient goes through the rehabilitation process of about 6 months, there aren't any further restrictions for athletics. Ava says this process and the care she received at Beacon is inspiring her to want to study nursing after high school.
When I had my surgery and I was here for 4 days in the hospital, I saw how the nurses were. They were amazing. They really did make an impact on my hospital stay.
Dr. McCoy says Beacon offers the only program outside of Chicago or Indianapolis that combines arthroscopy, which is a minimally invasive surgical procedure on a joint, as well as open joint preservation procedures. In the studio, Erin Leedy, WSBT 22.